welcome to our exclusive conversation of Smile Train Presents Inclusive Health, Bridging Gaps for Children with Birth Differences, which is based on Quality of Life and Impact Report by Smile Train India. Now, through this discussion today, we aim to highlight the critical need for cleft awareness and focus on a holistic approach to child health, including prevention, early diagnosis, management, and future readiness. We will also delve into the government's focus on cleft differences guided by the findings of Smile Train India's Quality of Life and Impact Report, the country's first comprehensive study on this treatable birth difference. Now, this report conducted is in partnership with KPMG India. It covers insights from parents and caregivers, assessing the organization's role in providing financial support, improving medical infrastructure, and training healthcare professionals. And well, to deepen our understanding on this very pertinent issue and to steer this conversation forward, let's now welcome our distinguished panel of speakers. We have with us Susanna Schaefer, President and CEO of Smile Train. Hi, Susanna. Welcome. We have with us Mamta Carroll, Senior Vice President and Regional Director, Asia Smile Train. Hi, Mamta. Welcome.
Hi, thank you.
And we also have with us Dr. Krishnamurthy Bunantaya, Maxillofacial Surgeon and Chairman, Smile Train India Medical Advisory Council. Thank you, everyone, for joining us today. It's such a pleasure to have you all with us. Mamta, let me begin with you. The recent Quality of Life and Impact Report by Smile Train India and KPMG India, it evaluates the social impact of cleft intervention across 14 states, as I also just spoke about it. What has been the thought behind formulating this report? And also, if you could share some critical insights with us about this report.
Smile Train is a charity. It's an NGO which is focused on clefts. And we have been, working in India for almost 25 years now. This is our 25th year. And therefore, we work with, 120 partner hospitals across all of the states. And we only focused on this one birth difference, which is clefts. And we do everything right from the surgery to the comprehensive care and so on. And therefore, at this stage where, we've almost worked for 2 decades, we wanted to basically we wanted to do an independent assessment of the transformation, of the impact that all of this program has created over the 2 decades. And therefore, this actually led us to partner with KPMG and to kind of, have them do this study for us. Right. Therefore, this study is very, very focused. It basically recreates or it completely goes over the entire transformation and what has happened. And the other aspect of the study is also, things that we should as an organization focus on. What is our next step? What is our next journey? What should we look at? What should be our now focus? Right. This is going to be a base plate or a baseline where we will obviously, work on the next steps and what we need to cover as an organization moving forward. So this, simply put, was actually the thought behind putting this study together. Right. And I'll share some very brief insights about, the statistics which really came out of the report is that 70% of the children who had undergone this surgery. In fact, the parents of these children who had undergone the surgery could not afford the treatment. Right. Imagine if it weren't for Smile Train. Right. So 70%. Imagine people said that they lack the financial resources. That's a big number. That's a huge number, right? And therefore, Smile Train stepped in and funded all these surgeries and so on and so forth. That's, our sustainable model. Another proof point was that 82% of partner doctors who are associated with Smile Train, we work with them, we partner with them and so on, received, training supported by Smile Train and under, their knowledge and skill building and so on. And this actually translates into almost 20 to 25 days on an average during the year is what we kind of, empower the local medical professionals to deliver that. And the third would be like almost 83% when we talk about the impact on individuals who had undergone the treatment. 83% basically felt that after the surgery they could eat properly, they could speak properly, some of them, and they could actually do the basic things of eating and drinking, which we as individuals take for granted. They could do it with great ease. So this, in a nutshell, is what the report is all about.
Right. Some great insights there, Mamta. Let me bring you in now, Susanna. Now, as someone who oversees the organization's mission to expand healthcare and cleft care capacity globally, give us a sense of how Smile Train India's work globally is influencing the cleft care in India, and what are some of the milestones that have been achieved so far?
In our 25 years of Smile Train, we have just reached a significant milestone globally, and that's reaching our 2 millionth completed surgery. And that was just recent. Last month in May, we made that announcement, which was very exciting for us. To bring those numbers closer to India, within those 25 years, 700,000 of those surgeries have taken place in India alone. So this is our largest program at Smile Train. And the significance of the study that we announced today with KPMG and just our work overall here in India is continuing to meet the care that's needed for these patients. You heard Mamta talk about that we have 120 medical partners that we work with here in India. One of which was an exciting announcement for us a few years ago, was creating a cleft leadership center. And that is located in Bangalore. That's actually Dr. Krishnamurthy's medical center that he's affiliated with. And this has become a training hub and a place where we can bring more complex cases. And we have that full suite of comprehensive care that is, enabled at this center. So there are multiple doctors there, not just surgeons like Dr. Krishnamurthy, but also orthodontists and speech therapists, because this is about the entire cleft journey for our cleft patients and bringing them along on that journey, which you heard many of those statistics from the report come out about being able to eat properly and speak properly. And that's where orthodontics, speech, nutritional support, that whole suite of care, a holistic approach, is coming from that center in Bangalore. Another exciting initiative that we've had recently in India in the past few years was the start of a 1-800 number. And this gives the ability for anyone to call this number, understand more about cleft, and then be directed to a treatment center. It could be any of those 120 partner hospitals around India.
It's a great initiative as well. Yeah. Well, moving on to you now, Dr. Krishnamurthy, could you elaborate on some of the primary causes of cleft lip and palate, and also provide some statistics wherein you can tell us that how prevalent this condition is amongst kids, and also the impact that it has on a child's health and development?
Right. Talking about the causes for this, what we know today is that it's a complex multifactorial disease, and the ultimate problem occurs in a genetic mutation, but there are a host of environmental factors which influence the changes in these genes. It is the most common facial birth difference that occurs in children, and it occurs in about 1 in 700 live births in this country and in many other parts of the world. In our country, this translates to about 30 to 35,000 children being born with this difference on the face every year. These children can have a number of problems. The first thing would be, particularly if they have a cleft of the palate, that they will not be able to do breastfeeding effectively. And that's where the problem starts. In addition to that, as they grow up, they might have difficulty in speaking, sometimes breathing and drinking as well. The other important problem that we have with these children is that since this is a visible defect, it affects the mental well-being of these children, and they face a lot of ostracization and bullying at school, etc. These are the host of problems that we can face with these children.
Some very useful tips and some very interesting insights have come so far from our discussion. Well, it's now time for us to take a short break, but we'll be back soon. Stay tuned. Welcome back to our exclusive conversation of Smile Train Presents Inclusive Health, Bridging Gaps for Children with Birth Differences, which is based on Quality of Life and Impact Report by Smile Train India. Mamta, now, coming back to you again, can you outline some of the main challenges that are related to cleft care, of course, in India and outside as well? And also, if you could also explain that how is it that Smile Train India is addressing these challenges, and what are some of the initiatives that are in place to tackle these challenges?
Sure. So I think the first, and it's a big challenge, it's an ongoing challenge, I must say, is about awareness.
Right.
Is about public awareness. Awareness on a, on larger level, which is, appreciation and understanding of the cause. What is the cause? How is it, to be tackled, and so on and so forth. And there is so much ambiguity about, why a cleft occurs, how did it happen to me, where do I go and get it treated, and so on and so forth. So awareness happens at various levels. One level is obviously, we have social workers who are a part of the system, who are a part of our partner hospitals, and, they go out and spread the word. We train them. So we tell them about, what the condition is, how does it look, how it has to be treated. Then the important aspect of awareness is also partnerships. We partner with government agencies. We partner with, NHM and RBSK and ASHA workers, because via their network, we are able to spread the word. We are able to go to those places which, normally you and I wouldn't be able to access those, because their network is really wide. And the other is through, centralized awareness, which Smile Train as an organization, conducts, which are, whether it's seminars or when we talk about via media, we are so honored to be on your channel today, because this is one medium which is a fantastic medium to get the message across, because I'm sure millions of people are watching this show, right? And therefore, people will know. Today, all your crew knows about it. And tomorrow, the viewers will know about it. So these are certain initiatives that we take at various levels to basically tackle the problem of awareness. The second, I would feel, is the affordability, specifically in low socioeconomic or, countries, LMICs and middle-income countries like ours, where even though people may know about it, they may not have the financial support, or they may not have the entire ecosystem in terms of finances to get those things together, and they cannot afford that. Simply put, they cannot afford the surgery. So how do you kind of, build that system where we are able to give a safe, quality, good quality surgery and cleft treatment, not just the surgery, comprehensive cleft treatment to that child. And therefore, organizations like Smile Train come in. And then we come to the third one, which is accessibility. Now, in a vast country like us, there are certain pockets still which lack the infrastructure, which lack, the safe facilities for a good, high-quality surgery. And therefore, we need more hospitals which are equipped with not just the equipment, but training medical professionals and good infrastructure, so that safe surgery can be provided to children with differences. And again, Smile Train's model enables that.
At this point, let me bring you back in, Dr. Krishnamurthy. Now that we've underscored and also building on what Mamta just spoke about, accessibility and affordability, now that we've kind of underscored the importance of early intervention, the importance of, nutrition, and the fact that there has to be access to financial support, there is one thing that continues to remain a challenge, and that is a comprehensive post-surgery care. What are some of the strategies that are in place, or can further be developed upon in order to give access to children who are facing speech distress? And how can partnerships also be leveraged to address this issue?
Yeah, so the first thing that everybody, the stakeholders, need to realize is that this is the treatment doesn't finish with surgery for the cleft of the palate, that once the child starts speaking, that we need to monitor the child and then make sure that she can speak well as you and me. Now, one of the things that maybe to some extent is lacking is we are not educating the parents to the extent that they should be aware that intensive speech therapy might be required in some of the children, without which the outcome of the surgery cannot be fully successful. So that is an area where we need to work a little bit. The other important things that we need to do in order to make sure that everybody benefits is to ramp up the infrastructure in terms of speech therapy facilities around the country, and also enhance human resources in the form of more trained speech and language pathologists and others who provide comprehensive care for these children.
Right. Okay. Susanna, there was an economic impact report which was released by Smile Train India globally that revealed that Smile Train has contributed a value of more than $69 billion globally over the last 25 years. Now, how does this economic impact translate at community level in India, and what are the broader economic benefits that are in place when it comes to investing in cleft care?
Sure. I just want to take a step back because that's a global study. So that 69 billion is a global number of Smile Train's work over our 25 years. And then to bring that to the India context, that's 16 billion given our 24 years here of work that's been brought back to India in the dailies that, disability adjusted life years. So those are some pretty amazing numbers when you think about it. But I think it's so much more about the life change, not just for the patient, but for the family. So, by investing, as our supporters, you heard Mamta talk about our supporters around the world, as they're investing in Smile Train and investing in that surgical intervention to help someone, they are giving back to, the economy globally. But in India, that 16 billion is also translating into families where there is so much burden taken off the family when, they're born, they have a child who's born with cleft. There's a sense of relief, right? But they can also work, they can, and then the patient whose life has been changed from this surgery can also become productive in school, seek an education, start to work themselves. Because in so many cases, patients with untreated cleft have lived a life of isolation, the stigma that Mamta talked about and Dr. Krishnamurti talked about. So now they're brought back into being a productive member of society, confident, right? So what better investment than investing in Smile Train?
Yeah, that's right. I'm actually going to ask each one of you to kind of close this discussion with your closing comments on this, that, how is Smile Train India faring in its contributions to cleft lip and palate treatment so far, and what is the way forward for Smile Train India? And I'm going to begin with you, Mamta.
Sure. So, we have covered ground, as you know, with the 7 lakh surgeries that we have supported thus far. But I think that this is just the beginning, because now we, as an organization, we need to concentrate on comprehensive care, which everyone spoke about. And therefore, we need to kind of, partner with other organizations, with the government and with other agencies to basically focus on the nutrition, whether it's speech therapy and orthodontics, and provide that holistic care. Right. And the other, I think, for Smile Train definitely is sustainability. So we are, that's my appeal to all of you and, the universe at large, to come forward and support Smile Train, support the cause, whether in awareness, whether you do want to support in kind by spreading awareness about it and, helping us and helping our partners, or they want to contribute to Smile Train. So I welcome that.
Great. And Susanna, how about you? Maybe you could give us a global perspective. How do you think that, the future is likely to shape for Smile Train?
Yeah, we made a commitment to cleft lip and palate and being a game changer in this space when we started 25 years ago. So to continue that commitment, we have to continue to invest, and that's in the training and education of medical professionals, because we committed to an ongoing long-term system of sustainable cleft care. So that is training that next generation of surgeon, training that speech pathologist, orthodontists, the anesthetists, the nurses, everyone that makes up that cleft team, that makes that ecosystem. And through our work, even though it's focused through a lens of cleft care, Through our investments, we have strengthened health systems overall, and we will not stop.
Dr. Krishnamurthy, on that note, you could tell us that, from a medical point of view, how do you think that, what further interventions are needed, and how is it that we are going to achieve a number wherein, majority of the cases are being looked after and most of the children who are suffering with, cleft lip and palate are cured?
I think most of the medical protocols are in good place. What we need to do, what we need to achieve is to provide this comprehensive care universally to everyone who needs it.
Thank you so much for your incredible insights and thoughts. And well, as we conclude this enlightening session, it's evident that collaborative efforts among Smile Train, government bodies, healthcare professionals and communities are crucial to ensuring that no child with the cleft is left behind. By continuing to raise awareness, improve access to comprehensive care and leverage innovative solutions, we can make significant strides towards a future where every child with the cleft can thrive. Thank you so much for watching.